Another question I commonly get asked has to do with the success rate of surgery. How likely is it that I'm going to get better? That's a very difficult question to answer because it varies from patient to patient. I know we've had patients before who've reached out and said, "I know you have a number. I know you have a number. You just don't want to tell me." The reality is that it varies from patient to patient, and medicine is not an exact science. But I'll give you the best answer that I can give you, the most honest answer that I can give you. I can tell you that in my experience, post-herpetic neuralgia, chronic pain after shingles, the results of the surgery will vary based on which part of the body is affected by the post-herpetic neuralgia. What do I mean by that? As an example, patients who have post-herpetic neuralgia of the face, those are the patients in whom we have by far the highest success rate in our practice. Greater than 95% of those patients a year after surgery say that they feel either significantly better or completely better, with of course the exception of the numbness that you would expect after surgery, right? The permanent numbness, that is, that you would expect after surgery. Compare that to post-herpetic neuralgia involving the arm, okay? So like up in this area here, or sometimes even up into the forearm, okay? That's where we found that we have the toughest time achieving success. I would say more than 50% of patients say that they are significantly better, but it's not 95%. Additionally, in this part of the body, because the anatomy, the nerve anatomy, the cutaneous nerve anatomy, the anatomy of the nerves that are responsible for sensation, it doesn't look always the way that the anatomy books make it out to look. And as a result, it's sometimes difficult to pin down every nerve that's responsible for the pain. And so, whereas on the face, greater than 80% of the patients will only need one operation, on the arm, as much as 50% of patients will need more than one operation before we finally nail down everything, okay? And then other parts of the body, the next most common part of the body that we treat for post-herpetic neuralgia is on the chest or the abdomen or the back, usually a combination of those. And the success rate with that is higher than it is on the arm, but not as high as it is on the face. Again, it's very challenging because the anatomy is it's really variable. It varies from patient to patient. It's not as though we have a well-defined roadmap for each patient. When we do the injections before surgery, part of the objective is to try to create a roadmap to help guide surgery. But it's not a perfect roadmap. And it's the kind of roadmap we can put together based on the best information and best technology that we have. A lot of people ask, well, can't an MRI tell you what's going on? If that were the case, I'd be ordering MRIs for all of my patients. But generally speaking, these nerves don't show up really well on an MRI. Same thing with a CAT scan. Ultrasound can sometimes show us these nerves, but the ultrasound won't tell us necessarily which nerve has the problem. But it can sometimes tell us if there's a nerve in the area that we're concerned about, which then helps guide the injections. Again, medicine's not an exact science, but thankfully we have a pretty good track record when it comes to surgery for treating post-herpetic neuralgia. And again, certain parts of the body we have a much better track record than we do in other parts of the body. But there's no perfect way to predict who's going to get dramatically better and who isn't. The best way for us to gauge the likelihood of success is with the nerve blocks that we do before surgery. The nerve blocks give us an idea of whether or not surgery is likely to be helpful. If the nerve block, if shutting off that nerve chemically, temporarily with a numbing agent, with a local anesthetic, is successful, that's usually a pretty good preview of what you might expect to experience after surgery. So patients who don't get a really dramatic response to the nerve block, I don't expect a really dramatic response from the surgery. Are there exceptions to that? Of course there are. I've had patients before who have come to me and said, "Doc, I know I didn't get a really great response from the injection, but I still want to try it because even a small chance of success is better than doing nothing at all." And some of those patients have had much better results than we got from the injection. But some of those patients have had results which were really pretty comparable to what we got with the injection. And that's usually my standard expectation. If you only got mild improvement with the injection, I would only expect mild improvement with surgery. And that's one of the main reasons we do the injection, is so that you as the patient can decide beforehand whether or not it's worth trying the surgery, to see if it's worth it to get the results that you get from the injection.